I'd absolutely classify morbid obesity as a disease. There's no question in my mind. It's certainly not cosmetic, it's not a moral issue, it's a genetically based disease.
I think part of the problem is that most diseases, there are simple answers to treat, or at least there are medications. There are algorithms where they can diagnose it, and then there are treatment methods. With obesity, it's a little different. Not only is there a bias against that in terms of not viewing obesity as a disease, but most medical practitioners don't have a good solution.
If somebody's overweight to the degree that we're talking about, they have diabetes, sleep apnea, hypertension, dyslipidemia, arthritis, all sorts of different comorbidities. To me, those are diseases in and of themselves, and you can treat them that way. But they're really signs and symptoms of the disease of morbid obesity.
I remember a patient telling me I have a magic moment that I want to share, and she'd been a kindergarten teacher for 25 years, and that day was the first day she was actually able to jump rope with her kids. So we focus a lot on the medical benefits, but I think a terrible comorbid condition is quality of life. And when you don't have that quality of life, it's a type of illness too.
When we see our patients for the first time, many times we find that our patients have been undertreated. The very patients that we need to take care of, we turn our backs on.
There have been many studies that document not only does undertreated obesity decrease the life expectancy, but it contributes to many of the diseases that are considered chronic diseases, such as diabetes, high cholesterol, high blood pressure, sleep apnea. And with all of those diseases, the cumulative impact would be a shorter lifespan and disability.
Studies have shown that if you're morbidly obese, we can expect a 22–25% reduction in life. That's a significant amount.
There have been well-done retrospective reviews, claims-made review data that show that treating obesity with surgery as a one-time intervention will result in a return on investment within 1 to 5 years. Again, that's amazing to think about, that intervention that is very effective, very safe, is also cost-effective.
You know, when I work with people that are obese, they often feel like they're the only one. But the truth is that obesity affects about 60% of the population are either overweight or obese.
I think sometimes you need to understand the patient, listen to their stories and see what they've gone through to understand that it's a disease. And I remember very early on in my career, I had a lady say, if I could treat this myself, who would choose to live this way?